is the next thing that we're going to be playing with. So, Bugsy sit. And Bugsy down. Yeah, you're alright. Oh, it's just so tough. Now, passive range of motion. Elaine touched on it just before with Adolf Hitler. So, what we know is with the passive, like, that's how the dog would normally stand, yeah? So, if we want to make sure that we're not causing any dramas, you kind of keep them in the areas that you know. So what I've got here for the elbow is I'm getting range of motion of both wrist and elbow at the moment by holding onto the elbow and then just, what's this movement called again?
Flexion, extension.
Flexion, yep, and extension. Now, we know that the elbow has also got two bones of the forearm. What do? This is another form of movement. Yeah, you're rotating, and it's called supination and pronation. So, that's it. And this is a nice way, also, if you've got an angry dog, this is a nice sort of way to look after yourself. So I'm getting some rotation, and that's supination, pronation. We can even do, you know, we were talking before with the phalanges. So with our little fingers, yep. So we can even go through that. And what's this area called? Yep, the carpus. So we know that there's quite a number of bones in there, and you can actually twist and turn as well, because there's quite a number of different movements in there. But to keep it simple, you know that you can get that sort of movement happening without any dramas. Now, it becomes a little bit more tricky once we get up to the shoulder, because there's something that's holding onto the shoulder, like there's a ball and socket joint for this upper arm bone, or the forelimb bone, I should say. And that's the humerus. The humerus has got the, starts with S? Yeah, the scapula. So the scapula's one that you can hold onto here, and you can kind of feel, depending upon your knowledge of anatomy, where the humerus is actually rolling around. So I'm holding on to where his collarbone could be if he was a tree climber. There we go. So now I can actually feel under my finger here, I can feel the humerus moving. And I'm stabilising the actual shoulder or the scapula just on the front part and also at the top here as well. Now, to get both the shoulder blade and the humerus moving, this thing, just wait. And what are we stretching here? We were talking in Elaine's lecture just before. Yeah, the tricep. So this is a brilliant stretch for those dogs that have got a little bit of TMJ sort of issues or trigger points through here. So myofascial release for the TMJ, or the temporomandibular, sorry. Yeah, that's just your jaw. And he loves that. So that's the spine with the baited stretches, and that's an active range of motion. Passive range of motion, I've just shown some of the forelimb. I'll go on to the hind limb so that you can kind of get an idea of some movement patterns that they can achieve. So again, I always kind of like to start at both elbow and knee, and it just gives them, alright, so this is familiarity. Bugsy isn't really a big fan of me playing with this hind limb at all, but he has to put up with it today. And that's the thing, like with the like he is really awesome allowing us to play with him for so long, but you know, you might get one or two movement patterns. So be it, that's cool. Over time, if you familiarise yourself enough with the dog or teach the owner to perform the movement pattern, they might be able to strengthen their companion animal bond with them as a result and be able to achieve this. So,
at what point, like, will stretching become bad? You know, like too much stretching forward?
you ready? What's he doing there? Yeah, he'll withdraw.
Yeah.
Like, and the other thing too is like, if you know that it's not in their normal movement pattern, like, and that's where your knowledge of, all right, I know that he stands like this, and I know that he can sprint, stretching out like that.
Yeah.
Like, if you go beyond that point, then of course, you know, like it's going to be bad. So range of motion is for the arthritis dogs, like getting that synovial fluid flowing, really perfect for that. If you're wanting to do the stretching of a specific area, like we know that this one's a really great stretch for the triceps, and this one, what are we stretching here, do you reckon? Yep, yep, but it's also, what's the muscle that runs across the front of the thigh? Starts with, yeah, that's one of them, yeah. Quads, yeah, the quadriceps. And we're also getting a little bit of a stretch through the, what are these areas? What's the loin? Yeah, you're on fire.
The erectus spinalis?
Yeah. So they're these guys are, you know, they're just, it's the loin muscle. We don't need to make it any more complicated. And I think, you know, stretching through here is a really nice one. And that's as far as you need to go. You know, a little bit of flexion and extension. And just like in the wrist, we're able to get a little bit of rotation as well. So that's just at the forefoot. Before you get down to, what are these on the ends called? Yep, the phalanges. And you can get some nice stretches of those too. Now, the hip joint, because the pelvis actually moves a fair bit, you can hold on to the front of the pelvis, and also, you know, their sit bones, they're exactly in the same spot as us. And then it's kind of nice with Bugsy here, around about 2/3 of the way along from the top of the pelvis, 2/3, and then that's the very, like, that's the ischial tuberosity, around about, you know, 1/3. Do you reckon that's right? 2/3, 1/3? Yeah. That's primarily where you'll find the hip joint itself. So that hip joint is moving forwards and backwards through it, and I can feel it underneath. And, you know, that's a really nice one for the older dog, like getting a little bit of movement there. And he has had enough. Oh. Bugs, thank you. Good boy. So their passive range of motion, and also some stretches as well using passive range of motion. So that's like really, really cool hands-on stuff. And then the fundamental stuff is just like your functional movements. Your sit, even the balance exercises are a little bit more, you know, like they're all functional. Going up and down stairs, that's as function as you can get. Next one is walking on lead, walking off lead, and you're identifying what their quality of movement is. You know, you're looking at them going, oh yeah, you pick up on their, whether or not they're lame or whether or not they're moving, you know, with purpose, their drive, all of those sort of components. But ultimately, you're moving the joints through their most optimal sort of movement pattern or congruent surfaces. So that's what it's all about. Now, this is where, why would we do it? So the next part is, all right, so if they've got pain or restriction, primarily from, you know, we've spoken already about one type of arthritis. What is it when it's the wear and tear of the joint? Do you know what type of arthritis it's called? Yeah, osteoarthritis. So that's a nice way to kind of get the synovial fluid flowing. But for pain and restriction, what do you kind of, like, apart from screaming and shouting out rude words, when you hit your funny bone, what do you naturally go and do to it? Yeah, you're rubbing it. And do you know why? What movement does is pretty amazing. So it will dumb down the pain centres being sent up to your brain going, oh, oh, oh. What it actually is doing, that same nerve is like, we'll say there's two pathways, like the telephone line going to your phone exchange. One of those pathways is now being stimulated with movement, and it's actually halving the pain that you're feeling because it's not both those nerves. Does that make sense? So still at that local site, you're getting, you know, the natural sort of inflammatory response and the, you know, the cascade of chemicals, but you're also getting the nerves being bathed in movement. I'm picking that up. Yep. I'm also still feeling some pain from it. So it's actually dumbing down the pain, which is really, really exciting and cool.
So is that only in local areas, or is it like you do it on the spine and
It's more in an acute sense.
Yeah.
Like, and this is how TENS machines work as well. Is it's small little bursts of muscle activity that are actually going back to the brain to dampen down that pain signal. So the pain signal is changed, and they call it, like, if you wanted to look it up, have a look at the pain gate theory. There, that's really exciting because that's essentially what exercise does. Yeah, movement makes you feel better. Like the endorphins that Elaine was talking about, you know, the natural body opiates, that's what movement is all about, and it's actually going to flood the central nervous system to go, this is making me feel so much better. We also use it post-operatively for, you know, if you stay still and immobilised for a prolonged period of time, what's going to happen to the muscles around it? Yeah, they're going to start to atrophy or shrivel up. So atrophy is just a normal part. Like, have you seen someone who's come out of a cast? Yeah, the difference in size in the muscles, that's purely because of lack of use. But if you were able to take that cast off and move a little bit, you may not have as much atrophy, if that makes sense, potentially. And you won't be as stiff. So you're getting rid of those tight sort of collagen network bundles that start to get really tight when you've got an injury over a site. It's good to some degree, but our body does go over the top with it in order to protect yourself. So that's a very important part to it. Now, pre and post exercise, like I was talking more along the lines of stretching. Now, you know, do you ever see a dog kind of go, I'm going down to the dog park, all right, stretching. But if you've got an older dog, wouldn't it be kind to actually go, all right, let's go for an on-lead walk first, and that's your warm-up. Or walking back, how about I come down and I'll chill out with you and strengthen my human companion animal bond with my best friend by performing those range of motion exercises. And you saw how much Bugs loves this. Like, you know, yes, Labradors do, but I can guarantee you, like, yeah, if you say this to a dedicated, and it's getting so cool because there's more and more responsible pet owners. I know sometimes in vet clinics you see the other side, but I do believe that, you know, the responsible pet ownership is actually, yeah, increasing and improving, and being able to encourage, you know, pet owners with their own animals in some of these little range of motion exercises. It's awesome. Like you'll have better business, I guarantee.